lovely. Take a seat, make yourself comfortable. My name's Dr. Sarah, pleased to meet you. I was just checking through your referral sheets here, and you're here for me to do a general checkup on you today for your employment. Is that right? Okay, that's perfect. We do a lot of these things. So I have a checklist from your employer of the things that they'd like me to check with you, make sure that everything is good. So firstly, I just want to check, have you had any recent infections or are you feeling unwell at the moment? Okay, that's fine. Okay. And any recent surgeries at all? Okay, fine. And have you been travelling anywhere abroad? Okay, where did you go? Alright, that's fine. So nowhere where you'd need vaccinations or at risk of disease, that's okay. Okay. Right then. So do you have an allergy to latex at all? Okay, that's fine. Let me just grab some gloves. And we'll take a look at you. Could you just confirm your current telephone number, please, for me? I'll just make sure that the notes are up to date there. Okay, that's perfect. Right then, okay. So first of all, I'll have a little feel of your lymph nodes around your neck, alright? Just to make sure there's nothing lumpy, bumpy, or feeling sore or tender for you, okay? Just let me know if anything's uncomfortable. Just go around the back here to check the occipital area. Okay, that all feels fine. Right, have you had any ear problems at all? Okay, right, okay. So what I'm going to do, I'm going to check your ears. I'll give them a little wipe around on the outside first. I'll have a little press around and then look in the inside of the ears, okay? I'll just give your right ear a wipe first. Okay, good. Okay, do the same on your left side. Okay. So while I'm here, I'm just going to have a press around the outer ear, okay? Tell me if anything's uncomfortable, my lovely, alright? Okay, good. I couldn't feel anything unusual there. All right. And on this side. Okay, perfect. Just make a little note there. Okay. that's all good. Okay. Right. So I'll take your temperature and then I'll have a little look down your ears, okay? This thermometer just goes inside your ear and you'll hear some beeps, alright? Any preference? This side? Okay. Pop it in here. Here we go. Temperature's perfectly fine. Okay. Wonderful. So I'm going to just put a new tip on there. So I'm going to use the otoscope, and the otoscope has a light on it, and the light just lets me have a look down your ear once I put this inside the ear canal, okay? Keep your head very still, alright? Try not to move at all. Pop up your hand if anything's uncomfortable, just while I have a little look. Okay, alright. So, here we go, just popping it in now, my lovely. Okay. Oh, that's a very healthy ear canal. Repositioning it there. Yeah, that's all good. You can see the tympanic membrane, your eardrum, and all the structures behind it are perfectly fine. Perfectly fine. Okay, I should withdraw that now. Okay, doing all right there? Perfect. Right, same again here. I'm just going to gently insert that, okay. Right. Again, a very healthy ear canal. No bulging of the eardrum. No retraction of the eardrum. Visible structures, normal amount of earwax, so that's perfectly fine. Okay, let's take that as well. There we go. Okay, that's all good. Right, I'll just jot some notes down there. Alrighty, okay, so I'm going to get a tongue depressor and I'm going to have a little look just in your throat, if that's alright. Okay. Alright, open nice and wide for me, my lovely. There we go, I'm just going to depress the tongue and I'm just going to come in with my light and just have a look down there. Okay, say R for me. Okay, just relax, that's fine. And while I've got my light, I'll just have a little look at your eyes. Just look straight ahead there for me. I'm just going to bring the light in from each side and check your pupillary reaction. Okay, just look there. Perfect. And again. Okay, that's fine. Okay, that's all good. Okay, Right, let me just get my stethoscope on here. Okay, just going to have a little listen to your chest, alright? Just move that there a minute. Just going to pop the stethoscope on. I'm going to ask you to breathe in and out for me. Big deep breaths in and out, okay? I'll do it with you for the first couple of times, alright? Here we go then. So in and out. That's good. And again, in and out. Okay. Again. Okay. Again. Again. And again. Okay, just round the back a little here. In and out. Okay. In and out. Okay. Just breathe normally for me now. Okay, I'm just going to pop this on your neck. Okay, that's fine. I'll have a little listen to your abdomen as well. Just move that there. Okay. You've had no abdominal pains or anything like that. Digestion seems fine. Okay. Right, just going to have a little listen to your bowel sounds. That's okay. All good. Okay. So while I've got my stethoscope, I'm going to take your blood pressure. All right. So, I'm just going to be putting this cuff around your arm. Okay. There we go. Let's outstretch that arm. Lovely. Put that on there. Okay. And put my stethoscope onto the brachial artery there. Perfect. And I'm just going to inflate with this, okay? Perfect. Okay, here we go. It's going to go tight, I'm afraid, just for a short time. That's perfectly fine. It's 122 over 82. I'm happy with that. So let's just remove that. There we go. Perfect. I'll pop that there. I can remove that now. Okay. So, make a couple of notes there. So have you noticed any weight changes at all? Okay, that's perfect. Right, so make a little note of that. Right. There's a few more things that are on the checklist for me to check. I will be taking some blood from you if that's okay. Yeah? Right, I'm just doing a couple of other little checks, so just bear with me a second. I'll just go and get the syringe ready to take some blood, alright? 1 minute. Right, got that. Okay, I'll put that there for a second. Right, so I'm just going to have a little palpate of your abdomen, okay? just check that before I do anything else. Just going to be pushing in. Okay. If anything's uncomfortable, please tell me. A little bit deeper this time. Okay. Now I'm just going to be tapping on the abdomen. Okay. Okay. That's all good. Okay. I'm just going to take a little look at the skin on your arms, make sure everything's healthy there. Okay. You don't notice any problems with your skin? No, just a little bit of acne. Okay. Yeah, your arms and your hands seem fine. Well, this side's fine anyway. Okay. Let's look at this side. Just relax. That's all perfectly fine, my lovely. Okay. Okay. So before I take the blood, I'm just going to do a little neurological check. Okay. They haven't asked me to go in depth. It's more about your sense of sharp or dull sensations. Okay. Alright. So I've got this wheel here. Don't be alarmed, it's not painful. And I want you to close your eyes. Okay. And I want you to tell me if you can feel something sharp. Okay, I'll just run that on your arm. Okay. Yeah. Or dull, which is just going to be my finger gently brushing down your skin like that, okay? Alright? Okay, so close your eyes for me. I'm going to start with your face now, okay? Tell me if it's sharp or dull, okay? Okay, sharp or dull? Okay, sharp or dull? Sharp or dull? Okay. And on your arms, sharp or dull? Okay, sharp or dull? Okay, sharp or dull? Sharp or dull? Okay, on your right arm, sharp or dull? Okay, sharp or dull? Sharp or dull? Okay, sharp or dull? Perfect. Keep your eyes closed for me. Okay, I'm going to run the wheel across your forehead. Could you just tell me if it feels the same all the way across, okay? Yeah? Perfect. Open your eyes now, my lovely, that's fine. Doesn't seem to be any problems there at all. Okay. So do you have any questions you want to ask me? Anything that has concerned you about your health at all? Okay, that's fine. Okay, I'm going to give you a sample bottle to take away with you. Alright, so I've got one of those here. Okay, so if you can just do a urine sample in this and drop it off at the reception desk after you've seen me. If you can't do it now, just drop it in later today if you can, and we'll get that checked, alright? Okay, so you can take that. There you go. Right then, I'm just going to do a little blood draw. I'm just going to be checking some basic bloods, okay? So it's going to be a full blood count. Alright, so that just checks how your blood composition is doing, your immune system, are there any signs of infection, inflammation. Okay, and I also like to run the liver and kidney function test as well, and also thyroid as well. And I don't think for a minute you've got a problem with any of those, but it's just so we get a nice picture. Okay, yeah. And the pathology lab will give us the results usually in about 24 hours. All right? Okay then, so I need to get a wipe here. Okay, any side of preference? Like your right side? Okay, so let's give that a wipe down there then. Lovely, okay. So I'm just going to pop this tourniquet around your arm. Make a fist for me, my lovely. Thank you. I'll just pop that on there. Okay. And got the syringe ready there. Right, okay. So you're going to feel a sharp scratch. Alright, so I'm just going to feel for the vein there. Usually have a phlebotomist do this for me, but they're fully booked, so I thought I might as well do it myself. You've got excellent veins. I haven't, mine are so bad. That's lovely. Right, okay. Just little sharp scratch as I do this, my lovely, okay. There we go. Perfect. Just need to change the bottle there. This is perfect. Just one more little bottle there. Just bear with me, I'll just change that. Okay. Okay, that's lovely. Let's take that off. That's one to go. Perfect. And if you could just hold this cotton wool on there for me, press nice and hard, that's wonderful. Okay. So let's get that in there, and that can go over to the lab. Wonderful. Okay. Okay. Let's just check that. Alright, I'll just pop you a little plaster on that, alright? Just to keep it nice and clean, but you've stopped bleeding. I don't think there'll be any bruising at all, so that's good. You were nice and easy to get blood from. Okay, let's just pop that on there. Perfect. Okay. Okay, so I'll send the report back to your employer. Everything is checked out fine. Like I say, it's only going to be the bloods and the urine test that we need to get the results from. But as far as the checks that they wanted me to do, you're absolutely fine. So there's no problem there at all. And they could always send you back to me if you were having any occupational health problems, of course. Okay then, so you go away with that urine sample bottle and I'll get the results over to your employer and they will relay the results back to you as well as soon as we've got everything together. Okay then? Perfect. Take care and enjoy the rest of your day.